Hello everyone, myself Dr. Neha. Today I will going to discuss about the anatomy of duodenum. The word duodenum derived from a Greek word dodecadectulus, which means that the length of duodenum is equal to breadth of 12 fingers. It is the proximal dilated and fixed part of the small intestine and is devoid of mesentery. It is having a C-shaped curve which encloses the head of pancreas and is subdivided into four parts. The first part is of 5 cm, second part 8 to 10 centimeters, third part is of 10 centimeters and fourth part is of 2.5 centimeters. These parts are depicted in the diagram. Now the first part of the duodenum. It extends from the pylorus to the superior duodenal flexure as we can see in the diagram. Pylorus is the last part of the stomach. Now the relations of the first part of duodenum on the anterior side, as we can see in the image, we have the liver, quadrate lobe of liver and the neck and body of gallbladder. Behind this first part, down-peritoneal, and it is related to the portal vein, bile duct, gastroduodenal artery and inferior vena cava. Then the above structures which are related to it. It gives attachment to the free margin of lesser omentum. Below, it overlaps the head and neck of pancreas, and the lower border gives attachment to anterior two layers of greater omentum. So these are the relations, posterior relations of the duodenum or different parts. Then the peculiarities of first part of duodenum. It is the most movable and behaves more of stomach than the duodenum. It is supplied by the end arteries affected by the peptic ulcer. It is devoid of circular mucosal folds. In the radiograph, the triangular radio-opaque shadow known as duodenal cap is observed in the barium mean. This duodenal cap is distorted in case of peptic ulcers or duodenal ulcers. Now the arterial supply of the first part. It is supplied by the supraduodenal branch of gastroduodenal artery, which is also known as artery of Wilkie. It is an end artery. Also by the intraduodenal branch of right gastroepiploic artery, which supplies the lower margin. Sometimes retroduodenal branch of gastroduodenal artery also supply this first part. Now we come to the second part of duodenum. It begins at supraduodenal flexure at L1 vertebra. It extends vertically downwards on the right side of the vertebral column and it ends at the intraduodenal flexure at L3 vertebra. So we can see this second part is the vertical part of the duodenum. Now the relations. Interiorly it is related to the right lobe of liver, as we can see in the diagram, transverse colon and few coils of jejunum. Laterally it is related to right colic flexure. Medially it is having a relation with head of pancreas, ventral and dorsal anastomosis of superior and inferior pancreaticoduodenal vessels, bile duct and main pancreatic duct. Now the posterior relations. On the posterior side, as we can see, it is related to the hilum of kidney, that is the anterior surface of right kidney, structures at the hilum, right psoas major and right edge of inferior vena cava. Now the interior of second part. When we see the interior of the second part of duodenum, we will find the circular folds. These circular mucosal folds are also known as plica circularis. Also we have major duodenal papilla which lies 8 to 10 centimeters distal to the pylorus, and the minor duodenal papilla which lies 2 centimeters above to the major duodenal papilla for accessory pancreatic duct. Also we find a circular mucosal fold just above the major duodenal papilla which is known as plica semicircularis, and there is a vertical mucosal fold between major and minor duodenal papilla which is known as plica longitudinalis. Now the third part. It is 10 centimeters long and it extends from inferior duodenal flexure to the front of aorta at the level of L3 vertebra. Relations are anteriorly it is crossed by superior mesenteric vessels and root of mesentery. These all are seen in the diagram. Posteriorly it is related to the right psoas major muscle, right ureter, inferior vena cava, right gonadal vessels, abdominal aorta, and origin of inferior mesenteric artery. Above it is related to the head of pancreas and inferior pancreatico-duodenal vessels. Below it is related to the coils of jejunum. Now the posterior relations of the third part of the duodenum. On the posterior side we can see the right psoas major muscle, right genitofemoral nerve, right gonadal vessels, right ureter, inferior vena cava, aorta, and L3 vertebra. Now we come to the fourth part of duodenum. It is 2.5 centimeters long. It extends from the front of aorta to the duodenojejunal flexure, which is situated on the left side of L2 vertebra. Relations are, on the anterior side it is related to the transverse colon, posterior-inferior surface of stomach separated by lesser sac. Behind we have left crus of the diaphragm, left psoas major muscle, and left sympathetic trunk, left renal vessels, left gonadal vessels, left suprarenal vein, and inferior mesenteric vein. These are also seen in the posterior relations. Now the suspensory muscle of duodenum. It is a fibromuscular band. It rises from right crus of the diaphragm to the posterior-superior surface of duodenal flexure. Structure, it is made up of three tissues, that is, in the upper one-third it is made up of skeletal muscles, in the middle one-third it is made up of elastic tissue, in the lower one-third it is composed of smooth muscles. Now we come to the arterial supply of the duodenum. It is supplied by superior and inferior pancreatico-duodenal artery. Venous drainage. The veins corresponds to the arteries and drain into superior mesenteric vein and then into portal vein. Nerve supply. It is supplied by celiac and superior mesenteric plexus. Preganglionic fibers arises from T6 to T9 spinal segments. Lymphatic drainage. The lymph vessels drain into pancreatico-duodenal lymph nodes. Efferent of these nodes drain into celiac and superior mesenteric group of pre-aortic lymph nodes. Now some clinical aspects. The first part of duodenum is prone to formation of peptic ulcers. Second part, it is affected by annular pancreas, which sometimes encircles and obstructs the second part. In such case, malignant growth of pancreatic head produces duodenal obstruction. The third part is vulnerable to injury because it may be compressed between vertebral column and valence through the anterior abdominal wall. Now there is Wilkie's syndrome, which is another cause of partial or complete duodenal obstruction due to compression by third part of duodenum by the superior mesenteric artery. So in the diagram we can see the third part of duodenum. It can be compressed between the abdominal aorta and the superior mesenteric artery. Now the fourth part. Fourth part of the duodenum is related to the peritoneal recesses. These recesses are first superior recess, which is blind above and opening is directed below. Inferior recess, this is blind and directed below and opening faces the superior recess. Retroduodenal recess, it extends upwards behind the junction of the third and the fourth part of the duodenum. Paraduodenal recess, it is blind on the left side and its opening is directed to the right. It is related to the inferior mesenteric vein. A loop of small gut may herniate out into these recesses.